Oh, it's like feels more clear now. Oh wow. Okay, that feels immediately better. Yeah.
Why don't you tell me a little bit what's going on?
Yeah, I feel like my right side is just completely misaligned. Everything just feels like off.
Can you show me where?
So my hip and my groin area.
Okay.
It only happens like when I have to engage, in a certain position. And
What positions?
it's like this, right here. I could feel it.
Okay.
Uh-huh.
Do you have to do that position a lot in
No,
sports or anything? Okay.
it's like when I'm doing like side lunges, things like that. Yeah.
Got it. Okay.
Just like from overusage. I normally do marathon training, and I just stopped because last time that I ran, there's just a lot of pain on the right side. Like my knee started hurting, and I would have to like kind of pop it back in to get it to stop hurting. It's constantly like popping in and out.
Okay.
So even if I'm just standing and like I try to like shift my weight like to the back of my leg, then it'll always like pop in and out the hip area.
Okay. Got it.
And then when it comes to like my shoulder and my neck, I think that's just overusage from like being on the computer for work too much.
What do you do?
I'm an HR. I'm an HR analyst. I'm on Excel all the time.
Yeah.
Yeah, it doesn't feel stable. Like sometimes it'll kind of give out on me, the right side. But my x-rays look like pretty messed up, pretty terrible.
Yep.
Yeah, so I sleep with a body pillow and I need to have it like elevated up. And then just sometimes, like I said, I need to like kind of stretch out my leg and then it feels better and then I can sleep, I guess. And then I was telling my case manager that I feel like the right side of my face is like swollen.
In what way?
Like this area, like right here, I feel like is swollen. I don't know if you can see it. I can always see it, but.
Do you have jaw issues, like when you chew or anything like that?
I don't think I do. Like my mom clenches a lot in her sleep. My dentist did recommend me to get a night guard, but like I don't really think that I clench. I don't know.
You may. So can I just look at how your jaw tracks? So
Sure.
Can you just like smile and open your mouth? There is a point where I don't know if you feel it. There's a point right there. So when you keep going, it kind of pops out a little bit.
Oh really?
Yeah. Typically that actually means you have a problem on that side and it's pushing that side. Yeah. But go ahead and do that one more time. Close. Okay, one more time. Close. Okay. So it's not too bad into there, so that's good. You don't really have a huge TMJ issue.
Okay.
Which is good. But it might be swollen because of something up there, so I'll check that.
Yeah.
Okay. So we run this every single time on you, but you've seen that already. People have insomnia issues. I'm really looking at this area, which is actually where you're kind of kinking over. So this is the area for your adrenal glands. Your circadian rhythm is really dictated by the health of your adrenal glands. So your adrenal glands is what produces cortisol, the rhythm of like your sugar, and then basically how you wake up, right?
Yeah.
The nerve supply that actually goes there is right here in your T12. You see how you're kinking like far over from that? So basically that's kind of a stress point for us to look at because structurally it just basically crushes down onto that part of your spine.
But so the spine will affect other organs?
Absolutely, yeah. Besides insomnia, are there any other health issues? Is this tender right here?
Yeah.
Is that typically where you feel it in your shoulder blades?
It's more like here, I think.
Like more
Yeah.
out into here?
Yeah.
That hurt?
Yeah.
Yeah. Okay. So that's part of it. You don't ever have any reflux or anything like that, right?
Acid reflux? Yes, I do.
You didn't tell me you had other stuff. But I need to guess it. Well, That is a big one for acid reflux. So it has a lot to do with one, liver, but also basically your sphincter. That actually is why you kind of reflux, because it can't actually close all the way. Look, T6, acid reflux. Okay, so if you want a chart to kind of see it, you might get more than one benefit than just pain.
What
Cool.
about like sinuses and like?
Sinuses? Depends. So is it drain like a lot, or is it just like really stuffy?
Stuffy.
Really stuffy. Have you had any surgeries or anything like that for it?
No.
Okay. Which part is it? All your sinuses that are stuffy, or mainly like your front or your maxillary? Like which sinuses?
I think my nose.
It's mainly your nose?
Yeah.
You never broke your nose, right?
No. No.
Can I see you without your mask again? So your septum is actually going this way a little bit. Yeah.
Okay.
So you have a small deviation in your septum, but we can work on that too. We're going to work on this area, because this is where your spine starts reversing.
Okay.
It also helps with the sinus congestion as well, but I'm going to work on a little bit in your sinuses. I'm also going to work on your T6, with the reflux, and then also the pain that you're feeling into your shoulder. So it radiates not just into your spine and your ribs, but also as part of the organs, right? Nerves don't just go to your muscles, right? They go to your organs too. So the T6, and then also we're going to work on that hip. Cool?
Okay.
So what we're going to do is we're going to actually shoot this up like that, okay? So you just relax and good.
Feels better, I think.
Feels good. Okay. So I'm going to do what we call a PIEX pull. So what that means is this is shifted down and out. So I'm going to shift it up and in like that.
Okay.
Just going to have you just relax the shoulder. Good. And I'm going to give this a pull like that, okay? So just relax here.
Oh, it doesn't hurt as much. Oh.
Yeah.
Oh, wow. Okay. That feels
What do you feel?
immediately better. Yeah.
You're doing that stretch?
Yeah.
So what do you
Okay.
notice?
Interesting. No, it doesn't hurt like usually when I go this far down, like it already starts hurting. So cool. Yay.
I know. That's what specific chiropractic does.
Okay.
Yeah.
Cool.
That's
awesome.
good.
Yeah. Thank you so much.
Yeah. We got one more to do. Relax your belly, let this sink in. So this lets me kind of use gravity to adjust that mid back. This is a T6. That's the rib over here, and that's the rib head. It hurts right there, right?
Mhm.
Yeah. Okay. So let's go. So just relax your belly down, and I'm gonna give this a little push, okay? Nice.
Whoa. Oh, I feel it a little bit. I think it feels like looser.
Yeah. You might feel a little bit sore because there's a lot of muscles that attach over to the rib, but it should do better.
Okay.
Yeah, try moving your arm around. It's less.
Yeah, I think it's less stiff than before. Yeah.
Nice.
Okay. Cool.
Try to really tighten adductor muscles. They typically kind of rotate in like that. But if we can reposition your structure, it'll allow that to automatically decrease
Right.
without stretching it or doing anything like that.
Right.
So that's where it differs from like physical therapy, because we're working on the structure. Actually, I want to do one more thing for you.
Okay.
I forgot about your sinus. Let's have you sit right here for me. So I'm going to adjust basically your maxillary sinuses, which is where you're kind of feeling it. So this is not going to pop, but it'll kind of be weird. So a little bit more. Okay. I'm going to go here. I'm going to open this one up. So we're going to torque it out and good. Okay, and then just in case, this is your frontal sinuses. A little bit more.
Oh, that hurts.
Yep.
Ow. Okay.
So when it's really congested, it can hurt a little bit. It'll feel better as we.
Oh, that means I'm really congested up there then?
Yeah, so all your sinuses can get really congested. Yeah. Quick. So just opening up your tympanic membrane. Nice. Okay.
Okay. whoa, I feel like more, I don't know, awake or something.
We are just going to work on that nose a little bit, okay?
Okay.
Okay. So it's gone that way. So they call this the nose job in chiropractic. But basically, your septum's deviated, so we're going to basically push it in like that. Just relax, and I just gotta feel it. Good. Okay, so just relax. Nice. Okay, that's it.
No, I can already feel it.
You can already feel it?
Yeah.
Wait, you can feel. Hey, you're breathing different?
Yeah, it's like feels more clear now.
Nice.
Okay.
Thank you.
Yeah.
Yeah.
Thank you so much.